From MTN News, this is Montana This Morning.
The first 100 times you have that wave of grief, you may think, I'm not going to get through this moment. And then the 101st time, it feels just as bad, but it is more familiar, and we learn how to comfort ourselves.
MTN's Donna Kelly delves into how grief can affect our brains.
And when a Mother Nature rips apart a community, the cleanup can take months and sometimes years. Coming up at 6:36, why sometimes federal help is slow to arrive.
Well, happy Wednesday, Southwest Montana, 6:32. Chet Lehman, Jane McDonald, Matt Elwell with you here. Winter's still very much in effect on this spring day. The wind's blowing, the fog, the snow, more snow coming in.
Ice on the ground.
Right?
Yeah.
Other than that, it's
springtime in Montana.
It's great.
lovely. The flowers will be blooming any year now.
Yeah.
Crocus, croci.
They're under there.
Yeah, we talked about that.
Crocuses,
the
yeah.
feet. Yep.
Croci. I'm going with croci just because it's more fun.
You can. You're a man of words.
Typically, I do paint an eloquent picture some days.
Yes, you do.
A little icy this morning. Temperatures into the 20s. We are keeping an eye on the potential of snowy conditions for the afternoon. We're talking pretty minor accumulations for most of the area through the afternoon, early evening, but we do have some concerns for travel over the course of the next couple of days. Spotty snow showers late in the afternoon into the evening today. Daytime highs chilly and a little breezy in a few areas. That will make things a little bit more uncomfortable. Be prepared, not only on the way out the door, but on the way home as we're dealing with slick roadways across the region. Talk more about the foggy conditions and visibility improvements we've had in just a little bit.
Right, thank you, Matt. It is now 6:33. When someone we love dies or has an emotional loss or change, it can be all-consuming.
Yeah, a woman who grew up in Dillon and is an associate professor of psychology wrote a book about her research. MTN's Donna Kelly talks with her and shows us how the universal feeling of grief lights up our brain.
You've written a book, The Grieving Brain. What happens to our brain when we're hit with grief?
What's surprising is that you can't really talk about grief without talking about love. And so really what happens in the brain is that when we bond with someone, we form unique connections physically in the brain. And that means that when that person dies, it really is like a piece of us has also gone missing. And so it takes the brain a long time to understand this person is really gone. And
How did you study that?
the way we study it is the wonderful participants who are willing to come in and do grief research. They bring us a photograph of the person who's died, and we're able to scan that into a computer and then show it to them on goggles when they're lying in the neuroimaging scanner. There's a part of the brain that's very important in our yearning response, yearning to have that person back. And this little region called the nucleus accumbens.
That old saying that time heals all, but it still hurts. And maybe even just in a different way, no matter how long it goes on.
Yeah, that's exactly right. So I think of there as being a difference between grief and grieving, so that, the first 100 times you have that wave of grief, you may think, I'm not going to get through this moment. And then the 101st time, it feels just as bad, but it is more familiar ourselves in those moments, or how to reach out for support in those moments.
I know that there's no normal probably process for grieving because everybody's different, but is there a point where you start to worry about somebody if they're not functioning?
So the part for me that gets worrying is, if after more than a year, people are not able to do things that they want to in life, get dinner on the table, get out to work, maybe listen to music. We think it's important that there are actually really helpful psychotherapies that are very specific and can help people get on a more natural sort of healing trajectory that we expect.
We all will experience that grief of some sort.
Definitely. And, grief comes in lots of flavors. The death of a loved one, certainly, but also romantic breakups, divorces, even kids moving away from home, the empty nest, times when we have homesickness or we retire from a job. So there are lots of things that cause us grief.
In Bozeman, Donna Kelly, MTN News.
Now O'Connor will be a part of the Gallatin Valley Circle of Compassion's annual Mountains of Courage conference this year on death and dying. It's this Saturday. You can find out how to buy tickets on our website.
6:36 now. Other recent natural disasters have communities still cleaning up months and sometimes even years later.
Yeah, Thomas Hoppe looks at why federal help isn't always available.
And I heard a loud bang and crash. And I came out and opened the front door, and it was just a total disaster everywhere.
Today, natural disasters seem like a common occurrence in our world. In 2022, there were 18 U.S. natural disasters that cost at least $1 billion in damages and repairs, according to the National Oceanic and Atmospheric Administration. It was the third most expensive year for disasters in American history.
We are currently in the debris management, debris collection stage of that, but lots of homeowners have impacted. What was unique about this tornado, and this will be our fifth one in about 15 years.
The February 2023 tornado in Norman, Oklahoma did not cross the billion-dollar mark, but its impact is still being felt weeks later.
I think the city of Norman will probably have about $1.6 million, $1.7 million in just city of Norman public impacts of dollars.
The Federal Emergency Management Association has funds to help out these communities when process. FEMA states any request must be beyond the capability of the state.
A threshold of damage that the city, the state, and then the presidential declaration happens for federal funding before you are eligible. So invariably, of those 19 events, I'll bet maybe 8 of them have actually qualified for federal funding. The rest of them we've been on our own. The governor still has not declared a disaster, so I'm having doubts that it's going to happen.
In a place like Norman, Oklahoma, where FEMA funding is unlikely, the cleanup costs fall on the local community, which is why it's important that these communities have money stored away and a plan for when disaster hits.
Norman, we do have a rainy day fund in our regular budget for whatever might happen, whether it's a storm or an IT, breakdown or something of that nature. So we do have rainy day funds, or a savings account, if you will, that is there for this purpose immediately. Our citizens need help right now. We can't wait for the federal dollars or other grant funds, but there's really no hesitation for us. We jump right in and get the work done.
Thomas Hoppe, Scripps News, Norman, Oklahoma.
All right, shifting gears just a bit, it is one of the best ways to prevent illnesses at home and in the hospital. And we know hand hygiene contributes to the spread of healthcare-associated infections that affect 1 in 31 hospital patients.
And now a group of medical organizations are updating their recommendations for prevention. Michael George has more.
We all know hand washing is important, but many of us could do a better job scrubbing more often and the right way. Now, 5 medical organizations are coming together to recommend strategies to prevent healthcare-associated infections through hand hygiene.
It's the basic foundation of all infection prevention in a healthcare setting. We are updating this guidance because there's a lot of literature about how we can improve hand hygiene, and we need to improve hand hygiene.
The new guidance recommends ongoing training in hand washing and proper use of sanitizer. Research suggests only 7% of healthcare personnel effectively clean the entire surface of their hands.
86% of the healthcare personnel performed hand hygiene at the appropriate time, but they missed their fingertips and they missed their thumbs. You want to have enough hand sanitizer, all of the skin on your hands.
And of course, hand washing is critical to protect your family from getting sick. The experts say lather and spend 20 seconds singing happy birthday twice.
Cold or warm water, doesn't need to be hot.
Dr. Daniel Sullivan from the Cleveland Clinic gave us a quick demonstration.
During that 20 seconds, cleaning not only the palms, but also our thumbs and the back of our hands, and then lastly, rubbing under the nails to get any virus that may be hiding under the nails. After the 20 seconds, rinsing and then drying with a clean towel.
And be sure to wash up before and after eating, using the bathroom, and after blowing your nose, coughing, or sneezing to keep everyone in the house safe. Michael George, CBS News, New York.
Now, hand washing is also important at home if you're handling pet food and treats or waste, and after touching garbage.
Goes without saying.
Yeah, you'd
Don't
hope.
forget your thumbs, though. That's a good part there when you're using all of that.
The missing digit all the time.
There you go. All right, we're going to take a break here on Montana This Morning. We come back, all of your headlines. And then if you're planning on going on vacation, the big question is, how are you going to get there?
That's it.
John Matteries has some advice.